right. At this time, I'm going to call this meeting to order. Please silence any cell phones that you may have at this time. Val, please call the roll.
Commissioner Penny?
You're absent.
Okay. Commissioner Curry?
Here.
Commissioner Danio? Here. Commissioner Johnson? Mayor Villa?
Here. Welcome to the City Commission's workshop tonight, October 26, 2021. I'm going to toss it right over to Mr. Forte to do the introductions.
Okay, so this workshop is to get presentations from the two benefits consultant providers. We have it split it up into two sessions. One is for Essentia to do their presentation first. It'll be about a 15-minute presentation, followed by questions from the commission, and then maybe a few minutes of a break, and then the folks from Brown & Brown will come in. Folks from Essentia will go wait out in the conference room, do the same thing, and then if there's any time left, the commission will talk amongst themselves. You've got grading sheets that are in front of you that you should have graded your presentations already at this point. And then following the presentations, you may tweak your scores depending upon whether you liked or didn't like something that you heard or a question during the presentations. And at the end of this, you'll hopefully come up with two rankings of a 1 and 2. At the end of that, I'll collect those rankings, and then we'll determine what this committee's recommendation would be to the City Commission. And then we go to the commission meeting. It's on the regular agenda for a final decision. There are 5 of you up here now, including Chief Bland, who took the place of John Penny, and John Penny had to recuse himself because it's technically considered a conflict of interest due to the relationship of a family member he has working with Brown & Brown. So when you get to the commission meeting, John Penny will not be a voting member, nor will Jim Bland, so you'll only have 4 members. And I'm hoping to avoid the possibility of a 2-2 tie, that whatever decision the committee makes, it would be my recommendation that the commission support the committee's recommendation, even though you may or may not be on the winning side of what that recommendation may be. So that will hopefully avoid us getting into a split vote at the commission meeting. Is that kind of agreed to?
Perfect summary. Okay. So we're starting with Essentia.
Yeah, so we'll start with Essentia. I'm not sure, I don't know all the players necessarily, and
all right.
We'll let them go ahead and up and introduce
Come on up and introduce yourself.
Is this information different than, this is just your presentation?
It's just our presentation.
Okay.
We're printing it out.
Good. Do you have something you need to put up
Thank
on the
you.
overhead?
Yes, we did.
Okay, Val could put it up there for you.
It's a copy of this presentation. If it's easier, we can probably work out the binders if that's what you would prefer.
Well, we'll work out of the binders, but there are a couple of members of the audience that may want to see it, so if we'll try to follow along as best we can, and Val's pretty good at clicking for you.
Fantastic.
I'm going to just close the doors in case, and we're trying to do this without the other vendor being here, so I don't want anybody to come in. If you could please give it to Val, she just walked out for a second. Hey, John, if you see them, you'll direct them to the conference room. They may not come, anyone from Brown & Brown, they may not come till 5:30 because that's when they're scheduled to present.
I got you.
All right, so in the meantime, while we're getting that loaded up, would you like to introduce yourself and your team?
Absolutely. Thank you, Mr. Mayor, and thank you guys for the audience this afternoon. My name is Chris Tolland, and I am an Executive Vice President at Foundation Risk Partners, and I also oversee our Northeast Florida region for Foundation Risk Partners, which is comprised of 3 different brands that FRP operates, including Essentia. My role with the city is essentially the chief promise keeper. Our team is a fantastic group of hardworking insurance professionals, but in the rare event that something goes awry, the city should absolutely reach out, and you have my commitment that we will use any and all resources at our disposal to make that issue right. We do have an outstanding team with us here tonight. To my right, Alex Doberstein, proposed team lead, and Alex leads the Employee Benefits Division in our local Daytona Beach headquarters office. Also with us tonight is Robin Riley, Account Executive, and she will be the primary contact for Human Resources at the city. Robin is to my left. We also have with us Allison Rand. Allison Rand is our proposed account manager, and other teammates supporting us this evening include Jonathan Jalad, Michelle Caudell, and Paul Shandell. So in our presentation this evening, we are going to illustrate and highlight the following. We are going to show you an 18.5% decrease in broker service fees while providing enhanced services to the city. We are also going to highlight recent proven results in Volusia County and throughout the state of Florida, in which we were able to actually leverage the marketplace to drive either very little or no increase from an incumbent carrier. We achieve these results by offering creative and unique approaches. For example, one of the things we'd recommend the city explore this year is a 2-year renewal commitment with the incumbent in order to further reduce the renewal rate. And we have a success story that we'd like to share with you there as well. Lastly, we excel at creating deal tension by thoughtfully negotiating with the marketplace and using leverage, using those results to leverage the incumbent carrier and to bring forth the most aggressive and competitive options for the city. Finally, we'll guarantee no disruption to the open enrollment schedule, and we will be able to provide enrollment services on or before November the 15th. I will turn it over to Alex Doberstein.
I'm just going to hit on, the agenda that we have in here. This is page 2 of what you have in front of you or up here. We're going to go over today the qualifications of our team. We have an expertise in public entities, working with public entities, as well as working in this area, in this community, knowing the local marketplace. So we'll hit on that, on the experience of our team as well. The first one is the qualification of the firm, just showing our size and who we are, a little bit about us. And then we're going to hit on what was requested in the RFP and showing that we're capable of doing that and our commitment to providing all the services that are being asked. And then going over what we learned from taking a look at the marketplace as far as different plan options with different carriers and designs that are out there and available to the city. And finally, some additional value-added tools and services that we really think could enhance your employee benefits program. We're going to hit on at the end there. So I'm going to turn it back over to Chris, who's going to go over the qualifications of our firm, which is page 3.
Yeah, page 4, actually. So Foundation Risk Partners is a national organization headquartered in Daytona Beach, Florida. We are recognized as a top 18 brokerage and consulting firm in the United States. We have over 1,500 insurance professionals across 17 states. We place over $2 billion of employee benefits premiums. And we serve clients in all 50 states. We also have 43 offices in the state of Florida. In terms of our Essentria Public Risk Platform, this is a specialty practice owned and operated by Foundation Risk Partners, also based out of Daytona Beach, Florida. We are the trusted advisor and proudly serve Halifax Health, your incumbent Florida healthcare plans, and the city of Deltona. We are also highly committed to our local community, provide financially to many organizations in town, and sit on multiple boards, including some of the boards you see listed on slide 5. Alex?
Yep. So next slide is just a little snapshot of some of the national brands that we serve as an organization on slide 6 here. So this I think goes to show that we're capable of serving complex needs, unique needs of some brands that you may recognize. We do some of the key things that really allowed us to win this business and to serve these clients. Our ability to support technology, benefits enrollment. So where employees go to make their elections online, we have a really strong expertise that. And the other big one is our communication strategy. So an example of that one that's not even on this board is we actually service the team that makes Sesame Street, that television program. So we do benefit guides, and it's Elmo explaining what a deductible is. So those are just some of the creative ideas that we're able to service our clients there. So we thought we'd just share some of the national brands. On the next page is a snapshot of the major fully insured health insurance carriers in the state of Florida. And as you can see, we have the highest carrier status with these carriers. So this is based off of the amount of business that we place with all of the carriers in the state. This level of being the highest broker status allows us access to direct decision makers at these carriers. So if you did ever, need something to be covered that may not otherwise be covered, certain concessions that need to be made, we're in a very strong position to be able to negotiate that for you on your behalf because of the amount of volume that we do with all the carriers, and we're appointed with all of your current carriers. As Chris hit on, Florida Healthcare Plans is actually a client of ours. We negotiate insurance on their behalf on the ancillary lines of coverage. So I think that shows as a vote of confidence in our capabilities as a brokerage that your health insurance carrier taps into us there. So wanted to hit on that. Next, on page 8 and then page 9 are some our faces there of our team that's we're proposing to service the city of Holly Hill here. So we have a lot of experience serving public entities. These are leaders in the industry when it comes to Florida public entities, and then a lot of experience for the people that are actually going to be servicing it. So my role is to be the team lead, to lead our organization, headquartered right here in Daytona Beach, a very large benefits operation right here in Daytona Beach. Robin is going to be the primary point of contact for HR and for the negotiating the renewals. Allison Rand right here is going to be the primary point of contact for any daily needs that you have. And then we have a really strong communications team with Amber, Taylor, and Ben. For any questions your employees have, we're able to be a direct resource to them. I am going to turn it over now to Robin, who's going to go over some recent successes with some public entities and how we help their renewals out.
Good afternoon, I'm Robin Riley. These are successes that I've had recently, one of them being in 2020 last year renewal. A carrier originally proposed 16% rate increase, and as we all know with budgets and stuff, you can't sustain that type of increase. So after managing through the city's request, managing a formal bid process and then final negotiations, the city changed carriers. They moved to Florida Municipal Insurance Trust, and we were able to mitigate their renewal increase to 3%. Volusia County City this past year for their most recent renewal, the carrier originally proposed a 13.9%. Claims experience was at 75%, and I'm like, oh my God, you've got to be kidding me. So after a thorough review of the city's claims reporting and underwriting renewal worksheet, we had a firm conversation with the carrier, and we were able to negotiate a rate pass and $10,000 in wellness contributions. On the next page, page 11, it's just a snapshot of our ever-growing list of public entity clients so that you can see that we're all over the state of Florida and growing.
And next up is we want to touch on what was requested in the RFP as far as our services. One of the big ones on slide 13 is the benefits enrollment technology. So currently you utilize PlanSource as your Ben admin platform. So this is where your employees log on to make their benefit elections and making sure that the benefit elections get to the carriers properly, get to the payroll system properly. And as I hit on, this is one of our core competencies that we're really strong at. So we are able to support PlanSource. So if you want to continue on your current platform, there'd be no change in services except having our team support it, which I think adds a lot of value because our team is very skilled at the communication aspect of it. So it's one thing just to have the technical person that understands the nuts and bolts, but being able to explain it to the people that are actually using it, the plan administrators, the HRs, that how to best utilize the system. So we're really strong at getting ahead of problems by understanding what the needs, what we're trying to get out of the system, and communicating what the platform can do, and then also educating the employees. If your staff, I presume, is a lot like a lot of our public entities, you have people that are not tech savvy, so it can be really confusing to say, oh, go elect your benefits online. So we really support that in multiple ways of educating them how to use the system, helping them out, walking them out step by step, and then if we need to be on site, we are more than willing and capable of doing that, being on site to go through the benefits with your employees one-on-one or in group settings to make sure that they're able to make their benefits election. So I hit on that a little bit on page 14. I'm going to keep moving quickly based off of our time restrictions here. But one other thing on slide 14 I do want to hit on, and also in your packet, is our commitment to service. So we do, included in the packet, is an outline of everything we're committing to as far as a timeline of what you can hold us accountable for. So this is a service timeline that we like to be very transparent with, our commitment to everything we're going to be doing, and be held accountable for those services. So we're very transparent and like to, deliver on everything we're promising there. Another big one is hitting on this timeline. November 15th is when we have open enrollment set for, which is really just a matter of a couple of weeks ago. Well, it's a couple weeks away from right now, so we're willing to commit to that. We're able to commit to making sure that everything's done, negotiating with the carriers and set up for November 15th timeline there. So that's, a tight timeline, but go ahead, Robin.
Sorry, I
Yeah.
also just want to add that timeline, it is customized. That's just a sample of looking at how your process works, but we would sit down with you, with staff, with human resources to make sure that it truly fits your needs.
Yes,
So
thank you.
just wanted to
Very
put
true.
that
Yep.
Down to that.
So then on slide 15 is a little bit more on the scope. There's how we support wellness. The number one thing for us with wellness is the communication. So we can have a good intentions, great ideas on how to do wellness where you're encouraging people to get healthier, to look after their health, to quit smoking, but it gets lost if it's not communicated properly. It just is looked at, an extra tax on not doing something or anything. So the key, even if it's just a matter of giving out resources and coaching and just a communication strategy, we're able to support that, and we got some examples on how we do that in the next couple of slides. But we are able to support a broad range of different wellness programs through our internal resources. So page 16 is examples of some campaigns. So we have pre-built campaigns, and we can do customized ones, or if you really want to get ahead of a certain topic, we have posters. We can do email blasts, postcards, get them out to the employees so they understand. So some examples of those are smoking cessation, or getting as we go on page 17, a step challenge where people are able to win rewards for taking a certain amount of steps. Then one more last thing on wellness is on page 18. We had another public entity that realized that there was a big gap in access to primary care. So we actually brought the primary care on site where employees were able to get their wellness exams from an actual in-network primary care provider on site, and they were able to review blood test results and high blood pressure, understanding what the needs of the population are. So that's a big one for us, that we really support wellness, and I believe it's a key part of the program. And then I'll turn it back over to Robin, who's going to hit on what we learned on the marketing.
So as the RFP requested, bids from the carriers. So our results from our carriers, the medical carriers, we received 2 carrier proposals. Humana bundled their medical, dental, and vision, providing a premium increase of 2.9% from expiring. They also offered a comprehensive wellness incentive program, and employees can earn up to $300 with that. United Healthcare, they came in with less than 1% increase from expiring, also committed to a comprehensive wellness incentive program for employees and spouse, where they can earn up to $240. The ancillary carriers, we received 2 proposals, of course, one from Guardian, saving 16% on the dental, and then savings of 3% on the vision. Humana bundled their dental is a 14% rate decrease, and vision savings is 24%. We also received firefighter cancer, which you were requesting as well. We received savings from the Florida Municipal Insurance Trust for the city of $1,000 in annual savings, premium savings.
Yeah, would love to. So in closing, we can show and we have shown a proposal which creates no disruption to your current open enrollment schedule and deadline of November 15th. We create no disruption with the incumbent carriers. We would like to explore a potential 2-year commitment with your current carrier to further reduce premiums. And we have proven results in Volusia County and the state of Florida as credibility. We are also proposing to reduce the broker fee by 18.5% less than the incumbent. We know you've been with the incumbent for the last 15 years, and we respectfully ask for the opportunity to handle the business. Thank you very much for your time.
Thank you very much.
I just want to add that behind there, because of time, we're limited, but I wanted to show you, we've got value.
Please come to the mic because we're recording. Thank you.
additional services that we've got. I've added that in the pocket there and behind on tab 5, where you can see we've got value-added services that we offer to help support HR. We've got a Century HR Online Resources and HR On Demand, a Century Client Portal, and then a certified compliance team. And we're here to support HR and to support your staff and work alongside with them.
Thank you very much. And we may have some questions for you. So any member of the board have any questions to start off with?
Mayor, I
Mr.
have,
Forte, do
I
you have
have
something?
Diane and Stella sitting up here because in their areas of expertise, they may have some questions that would help the committee in making their decisions.
Yes, sir.
But I wanted to start out with, I had a question that we had received a late distribution of one of the rate sheets. And that rate sheet was an increase in pricing from the rate sheet in the submittal.
Right.
So my question is, are you using the information from the rate sheet in the submittal or the late
The rate sheet that I submitted.
after?
Can I ask a question on that? In your presentation, and there was a lot of numbers to look
Right.
at, I'll just tell you that. You just said the Humana bundle is
Right.
983? Where is that in
So
this?
at the bottom, you'll see on the bottom of my spreadsheet, I advised that if you chose the bundled, it would be a percentage of decrease at the very bottom of the spreadsheet.
Okay.
So I went ahead and.
So that 2.9 is off of the
Yes.
one, the new price?
Right. Because the dental and vision is bringing savings and plan enhancements that I showed on there as well. So that's why I wanted to make sure to show the best pricing on the medical at our presentation.
So my question is, I heard in your presentation that you work with Florida Healthcare, and obviously that's great. If we were to go with you, we would still be able to keep Florida Healthcare?
Yes.
And tell me then, because I didn't see in the packet any cost breakdown for that, is that because we're going to get the same thing if we went with Brown & Brown and renewed, or you?
Currently, your current agent is Brown & Brown, so they only want to work with the current agent. So if we were to be awarded the bid, then we would be able to negotiate on your behalf to get different rates from Florida Healthcare plans. So we would have to become the agent in order to be able to propose it, and since we're not the company, we can't do that. As far as the rates, if we ask for the same thing with the same information, we're going to get the same rates. What I think we bring a lot of value is to try to ask for things differently. So an example is a group recently just renewed October 1st. They were similar situation, very large increase from Florida Healthcare plans, and then we had a really competitive offer from United Healthcare with a 2-year rate guarantee. So we went back to them and said, hey, this is a group that really cares about their employees, that they're utilizing the wellness clinics right now, that they, are really like the health, want to be a partners with Florida Healthcare, don't want to be disruptive. What can we do? And we're able to work with them to do, as Chris mentioned, a 2-year commitment. So we said, Florida Healthcare says we need a rate increase. The rates have been low, claims have been high. We need a rate increase. We said, okay, we'll get if we increase the rate, can you, and then Florida Healthcare said, well, we'll get it down to the number that's okay. We'll give you some wellness credit as well, but you have to commit to next year. If we come back with a reasonable renewal, an under 8% renewal, then you'll renew with us next year. A 2-year commitment that we're able to bring those rates down. So that type of, strategic working, making both parties happy, being a broker, not just passing numbers back and forth, is where I think we bring a lot of the value. So long answer to your question.
Thank you for that answer. And a quick question, and this is probably for Ms. Stella. What is our current claim percentage right now with?
Loss ratio?
Yeah.
That's a Diane question.
Diane?
And remember, this is a snapshot in time because that loss ratio is based on a certain amount of the previous months. And depending upon where you take that snapshot, there may be a claim in there that's either going to be in there for a period or it's going to fall off. So I don't remember what the number is.
Yeah, like the T32 plan, which is the HMO, that was close to 90%, like 89%.
And how many members are on that?
Not
Less
very
than
many.
a dozen?
Less than a dozen, I'd say, or right at a dozen, right,
Yeah.
about 7, 8 people. And then on the HSA, on the T95, it's about like 71%.
There's over 100 members on that.
71 is pretty good, right?
It's very good.
Yes.
Okay.
So, Mayor, I'm glad you brought that up, because I guess that didn't really register with me, that you have the ability to provide Florida healthcare insurance to the employees. I thought that we were limited to Humana or United. Or a consortium. Because one of my questions, the concern I have would be the inability of the other plans to offer the clinic model that Florida Healthcare does. And we've been driving a lot of the employees to the clinics rather than the emergency room or their PCPs to help our rates go down. And without a clinic model, one of my concerns is, they're going to be going to the ER again, and there goes my rates again.
Yeah, absolutely. And we're big Florida healthcare plans. They do a lot for this community, and we're thankful to have them. So especially with a late change like this, where we can't get ahead of the communication to the employees, any change we think would probably be highly disruptive. So what would be ideal for us is if you stayed with Florida Healthcare and made us your agent and allowed us to help you out on this renewal to get that rate down as low as possible. We can bring some creative strategies as far as tweaks on plan design, tweaks on the rates a little bit. One thing that really stood out to me on your rates is just the relationship of family coverage to employee coverage. You're not at the norm. Your employee rate's much higher than what we would see for the total premium overall. So your employee rate is really subsidizing your dependent costs. So that's something that we could work with Florida Healthcare to see what our options are on that.
Yeah, we kind of do that by design.
With the $0 contributions, is that what you're saying, or
Yeah.
by the design of the?
Yeah.
So that's just one idea out there, but
Right.
yep. Yeah, so yeah, we would,
There's flexibility in that.
yep, exactly, right, that's it.
Okay.
If we were to go with Florida Healthcare, would we be able to choose different dental and vision or the same? Okay.
Yes, yep,
Well,
see it.
Keep in mind, Mayor, that those are ancillary providers, so there are things like iMed, MetLife,
Yeah.
Guardian, which we have, and they have the ability to do those, except the other thing that I thought was missing out of your proposal was the life insurance. How do we get around that?
Robin,
On the life insurance, I did not receive information to be able for the carriers to quote. So that's why we don't have anything on the life insurance.
So what do we do for that?
you're currently with US Able?
Yes.
Yeah, so we represent US Able, so same on the medical, where we could be the agent and keep the plans as they are.
So we would be able to maintain them, and then you become the agent, and then you get that history that you can then.
And then from there, we can market it, and there's usually a lot of opportunities on that down the line, but not for this year.
Okay.
Good. Did you have a, Chief?
Yeah, I had a question. On page 55 of the proposal is the firefighter cancer.
Yes.
Can you explain the benefit of that?
And this is the state-required
Right.
cancer policy that we have to have.
Okay, I just wasn't sure of the actual benefit of it, other than it says it meets the Florida statute, I would imagine. So I didn't know what in the other proposal it had the
Yeah.
dollar amounts.
Yeah, I think it's all the same.
Right, so right now you're with Chubb. Your Class 1 is a lump sum benefit. Class 2 is the principal sum and then Class 3 is your first diagnosis benefit continuation. So you have different pricing currently on each one of the classes. Ours has a plan that goes right by the statute, the FMIT, lump sum cancer benefit with no recurrence benefit, and then lump sum cancer benefit with 2 times recurrence. And then you've got the Plan 3, which I think seems to be the best, is your lump sum cancer benefit that covers all cancer, excluding non-invasive melanoma, skin cancer, with 2 times recurrence benefit. And that's $1,500, which is still a lot less than what you're currently paying.
I guess maybe I just totally didn't understand this. What would be the benefit? Is this an employee benefit, or is this an
This
employer
is
benefit?
firefighter.
No, this is was it 2 years ago, the state came out with this benefit it's a cancer benefit for firefighters, and we had to get insurance to cover that. We had a hard time. Chubb at the time was the only one that we were actually able to get to provide that level of insurance, and it's a state mandated level of insurance that we have to cover. It's a lump sum fee, and then it's a certain amount of payment after.
Yeah, it's a city city costs, right?
Right.
We pay the premium for that for a benefit for firefighters who get cancer. And this goes back to a firefighter that you have on staff that had cancer but is free of cancer, but then he gets it back again, or you hire a firefighter and within a year he gets cancer, but he worked for another agency for 10 years, and who's responsible for that? And so we battled through all that at the time that we went searching for that policy.
Does that answer your
Thank
question?
you. Yes. Yeah, there was just a lot of options and tiers and
Yeah,
Right,
no, you're
I
right.
know.
lots of stuff.
There is a lot. With that, though, do we currently our premium's $29.12? So we have class 1, 2, and 3, and then the other ones are plan 1, 2, or 3? Is that correct?
I don't know. This is what I received as the benefit, so I don't know.
Do you know what the different classes
this-
are?
It is in the other proposal, but we do have all three classes, whether they're a current employee or if they're a retiree. So the benefit varies depending
Oh,
on
so that's what makes them the different class?
classes,
Okay.
correct?
So would we have to have all 3 of these listed with the alternative? Because that'd be like $4,000 instead of $3,000. Do you know that? Or do you know that?
I know we would have
No?
to go with every,
Okay.
the state mandates.
All right.
And this program is designed to meet the state mandates, and it's something that we can dive into more
Okay.
detail on. And once again, we do a lot of business with Chubb as well, so if it's a situation where we find certain
Could stay with
aspects of the
Chubb.
policy we like currently, we don't have to mess
Good.
with it if we don't want to.
Good to know. Yes.
I'm not sure if the question was received correctly or what, but I didn't hear an answer out of that. Am I looking at a total premium under the current of $29.12 is what it tells me? So for the alternate premium, am I adding together Plan 1, Plan 2, and Plan 3 to
Right.
get the total premium?
Total premium of $2,900.
If I might
There's
be,
plans, there's our classes. I had the same question. They're showing class 1, 2, it's,
Right, they're different.
and then different plans.
See,
So
so
now I'm
Chubb is,
totally confused.
Chubb provides one plan but different classes, and we're offering you 3 different plans for you to choose.
Okay.
Okay.
So then so you don't have, it's or, not and.
Right.
Okay.
And
yeah,
the highest
these are
cost one
two-
is $1,500.
these are 2 different plans. to
Okay.
choose from.
Yeah, on the 1, 2, 3, you don't have to purchase all 3. You
Okay.
choose-
Okay, because my main question was like the mayor's, I want to know the total premium.
Right.
So am I adding those 3 together or I'm not?
No.
Okay.
Plan
thank
3 is $1,500. That's the most richest plan. You've got Plan 1
Okay.
that's $1,100, Plan 2, $1,300.
Okay. Any other questions from the commission
So basically, almost half of the other companies that we're trying to look at?
for that one? But that's one small part of it. That's only,
On that one, right,
yeah.
okay.
I just have one
Yes.
for you. I'll make it simple. It say on page 12, if you look on page 12, it lists health coaching, disease management, and target programs to reinforce healthy lifestyle and the management of a biometric screening. What does that involve? What are you actually doing?
So I think that we're touching on a lot of things, and none of these are mandatory. These are all parts of a wellness strategy, right? So our first step is meeting with our clients to understand, what are we trying to get out of the wellness program? Are we just trying to educate and promote a healthy lifestyle, or are we trying to get?
Alex,
Oh,
please.
sorry,
Thank
yep,
you.
thank you. Are we?
Like a handout deal, or you're going to communicate with people?
That's it. So it's dependent on what level you're trying to do. So that the basic level is just a communication where we're putting out posters and flyers. We have some, even some public entities that want to get a lot more aggressive on their wellness program, saying people that aren't taking care of their health, maybe they need to be paying more. Or maybe we go somewhere in between there where we say, you know, well, how about you learn about eating healthier? How about you learn about exercise? And by participating in those activities, we'll, you know, reduce your premiums or give you additional HSA dollars. Maybe we make that HSA contingent upon doing certain things. So like the biometrics, that's just getting a baseline of where your health status is at. So get your blood work done, get your blood pressure done, get your cholesterol checked out, and know if you have an issue. We do sometimes do these biometric events, and people need to be going to the ER that day because their
Right,
blood
right.
pressure is that high. So it literally can be life savings, but from the employer's perspective, it shows either wanting to make cost-saving measures or that you care about your employees being healthier. So it really,
Can it come in future of this, that there will be like imposed fines for not having COVID shots and things like that?
yeah, I mean, that gets in a whole nother realm, but yeah, it could be within that for sure. So, I mean, the COVID's a kind of a different animal, the COVID vaccine, where
But it's still here in 2022 and 2023. It's going to, the government, I think, is going to back off on the cost, and insurance companies going to start picking up on it. It's gonna go.
yeah, and we have that. So originally, we were telling people, don't mess with the health insurance when it comes to the vaccine mandates, but we're seeing a lot of large employers going for it, even like, Delta Airlines. And
Fines on employees for not getting the shot.
Yep.
But we're not doing that. That's an agency decision. Yeah.
Yeah, you said that, not me, too, yeah.
Yeah, just want to make sure that's not the direction we're
Up
going.
there, make the record clear on that. But yeah, some employers do that, yes, and we can help educate on the compliance aspects of that. We have in-house ERISA attorney and compliance team that can help you kind of sift through what other employers are doing, what's legal, what's not, but certainly not a mandatory part of being your agent.
Well, thank you so much. We have a question from Ms. Gurney.
Can I follow up a little bit on the Florida healthcare aspect that you mentioned?
Yes.
This contract doesn't start till January 1st, which is the same time as the Florida healthcare renewal is. So if you're saying they won't negotiate with you until you are the broker, you're technically not the broker till January 1st. How are you going to accomplish that for us to have our renewal?
Yep, they don't wait till the renewal date, so we could have an agent or record letter signed after this meeting or tomorrow or anytime, and that's when they'll begin to honor it. So it's not through the same contract period as the insurance, it can be changed at any time there. So whenever we become the agent, we can begin negotiating the renewal on your behalf.
But you don't become the agent until January 1st.
So it's from the time that it's from the time that the agent of record letter is actually signed. So theoretically, typically there's a customary 5-day waiting period. So if the agent of record letter was signed on this coming Monday, we would be typically recognized as the agent of record by the following Monday by the carrier and able to negotiate on your behalf.
Even though our contract does not start with you until January 1st? This
Correct.
wouldn't violate our current contract with our current provider?
It's-
By providing an agent of record service when they're our current provider? Our current broker?
We should look at that other broker contract, but it's customary in our business, exactly as Alex is stating, that when an agent of record letter is signed, that is asserting that it's the insured's wish to negotiate with the agent who has been named in said agent of record letter.
And if we need to work it out from a compensation, yeah, we can just be authorized to negotiate on your behalf, but still let Brown & Brown be paid through however long you're committed to paying.
Through January 1, if there's a contractual restriction.
And just so the commission understands, historically, we had the agent of records timeframe started in January, and our insurance started in October. And then a couple of years ago, and I think it might have been due to Affordable Care Act, all the insurance is now shifted to January. So your agent of record and your insurance start at the same time, and they really never should. And if we move forward, no matter who we move forward with, we need to change the start and end date of the agent of record so that they are not on the same time schedule. They should be separated by at least 6 months.
By 6 months?
Yes.
Okay.
So whatever we do, if we did a contract, I would probably come back and recommend amending that one-year contract to be an 18-month contract, and then the potential of one-year renewals thereafter.
Okay.
And as Alex stated, if we were awarded the agent of record letter and there was a contractual prohibition on us receiving any compensation while that other broker was under contract, we would certainly cede all compensation to the other broker and negotiate on the city's behalf until we were able to be compensated.
Okay. Thank you for clarifying that. Any other questions from staff, members of the board? All right. Thank you so much. Great presentation. We may have answers or questions later, so we may have to bring you back up. But just
Thank you.
in respect to time, we have to move on. Thank you. So is Brown & Brown here?
They should be in the
Well-
back. Yeah, Val could,
After, can I make one
Yeah,
comment?
yeah.
yeah, it's-
Before we bring them in?
Yeah.
Okay. Wait, Val.
Val,
Wait 1 second.
you guys could leave, and then we're just going to hold off on them coming in. They want to talk a few seconds.
Excellent, thank you.
Hold off on bringing them back just yet. I turned it off. Unless somebody knows to turn it on. I do find it interesting that they can provide the Florida healthcare
Yeah.
and the
That was
other
my main
services. I
question.
didn't know that because one of my comments has been, I wish Accenture can sell us Florida healthcare because I'd like to try the experience of a different broker, and I think you'll hear that from Diane and Stella as well.
Right.
I just want to point out from a purchasing perspective that while the city commission has the absolute authority to waive purchasing policy, to do something different from purchasing policy, we are now not in compliance with the bid we put out. Now, you guys can decide that's fine, and we want to go with Accentria. But they have now submitted a different pricing list that was past the deadline. They've now told you that they can do a different provider, Florida Healthcare, and negotiate it, and doesn't fall with what they submitted to the
I didn't
RFP.
receive any information about
Yeah,
it.
it's outside it's outside their bid proposal, and that's why I'm saying I didn't know they had the ability to do that.
That's
So-
the one thing that I'm disturbed about, I guess, is the fact that if you could have provided us with the same information that you verbally gave me, why didn't you?
I think,
I wonder if there's
what
a
I'm understanding
restriction.
is that there's a relationship between the insurance company, Florida Healthcare, and Brown & Brown, that Florida Healthcare is not going to go to another party and say, you can represent us.
That's
But-
what he said.
But the industry standard is if we choose a different broker, then they can negotiate with.
Right, I think it's more of a restriction, just like if Brown & Brown was trying to take an Accenture, they wouldn't be able to go and get that Florida healthcare because they're already with them. It's one of those business things, but that was
I
my
do
main
find
question coming in today because I didn't want the disruption
I
of
mean,
changing.
I hate to bring up past bad bid histories, but you remember the towing bid?
Yeah,
And they come in and they want to
Yeah.
change the price and change the terms
Good point.
after the RFP has gone out.
Well, the only,
So I mean, you have the authority to do whatever
But
you
we
want to
don't have-
do.
But we don't have
but I'm
anything in
just-
writing, Stella. We don't have any writing saying they can go with Florida Healthcare over Brown. They just told us that, right?
That's-
Nothing.
That's the one thing that bothers me. That's what I'm saying. There was nothing mentioned in what I received. I'm only hearing it verbally now.
Right.
Granted, maybe you couldn't get pricing, but you could have mentioned the fact that you could take us to Florida Healthcare.
well, if they say they could, I have to imagine they're on record saying that they could. Maybe it's an ethical thing that you can't do that. I don't know. You know, the other alternative is at the end of
It
the night,
definitely is
if
an
you're
ethics thing.
unsure and you don't want to make the decision at the commission meeting, we could do another special called meeting just for this purpose, because I really don't want to run into November. We're running short on time.
I wish,
That's kind of an unknown that I don't have an answer for you.
I wish Scott was here.
He's running, I got a text, he's in traffic, he's running late.
Because maybe we need to talk to him as well about
Yeah,
it.
and that's what I'm saying, so if you can't reach a conclusion tonight, and you want to hold off and maybe hold a special meeting Friday or something.
But, before we do that, like Stella pointed out, this has all the remnants of that tow contract.
that's why I say-
don't wanna make any special concessions for either one of them.
That's why I said you can wait and get the legal opinion from Scott.
Okay.
That I can't give you the answer, I don't know.
Well, Scott, when is Scott going to be here? Right at the
He just said
beginning of the
he's
commission
stuck in
meeting?
traffic.
We still have a list of problems.
Yeah, we do.
So you,
All right,
let's
well,
go ahead and hear the next
Are
presentation.
there any other further comments before we call Brown & Brown in? All right. And welcome, everybody. We're having a workshop right now about insurance services. We're probably going to be starting the commission meeting a little late because we are behind in presentation, so I apologize for that, but we have to get it done tonight. So with that, Val, can you please call Brown & Brown in?
Put something in the front, and we can also do Florida Healthcare, but we can really tell you about that.
Hello. Welcome.
Hello.
Take your time, get set up, and Val, do you have anything for Val to put on the overhead? Okay. Appreciate it.
Thank you. Blue eyes.
Yeah.
Chair. Okay.
Whenever you're ready.
All right. Yep. Whoever goes first, you can
Thank you.
Kick it off.
And good evening. Thank you for this opportunity to speak with you today. We appreciate it. I'm going to speak very briefly, and I'm going to yield the floor to Jessica so she can walk through our response to the RFP. But I just wanted to, first of all, say thank you for the business. My name is Steve Farmer. I've met most of you. I'm an Executive Vice President with Brown & Brown. We appreciate the Holly Hill relationship, and what we've tried to do with Holly Hill over the years with your benefits program is create consistency, not only consistency in pricing, but consistency in your plan design. And as you've looked at probably 30 quotes from benefits providers, you're going to see that there's always a lower price. And when you focus on price, sometimes you do that at the expense of your program. Jessica's going to talk a lot about disruption in a program, disruption in your doctors, disruption in your network, disruption in your clinics. All of those things come with changes in carrier partners. And we presented options that range from a 10% decrease to as much as an 8% increase. So we just want to make sure that we're focusing on those plan designs. Secondly, I wanted to talk a little bit about the investment that we made at Brown & Brown because I think it bears in these processes. Number one, we've made big investments within our benefits unit in analytics, data analyzation, claims handling, as well as different looks at plan designs. And the reason that we do that is because we want to control the underwriting process in conjunction with your team. We never want underwriters to dictate to us what the rates are going to be. And in this world that we live in with data and having the ability to access your claims information as we do, we can put together data so when Jessica goes to an underwriter to negotiate your plan, she already knows what the rates should be, and that's our starting point for our negotiations. So those investments have been made at Brown & Brown. And that leads me to my last point, and that's our experience in this space. You know, I've sat through a lot of scoring systems. I've been handling public entity accounts since 2004. And a lot of times when you're talking about experience, teams will look at it and say, well, they handle benefits and they handle benefits, so they're both experienced, they're both the same. I wanted to point out our experience in the public entity space. I think it's well known that Brown & Brown is the leader in the state of Florida in the public entity space. But in Florida alone, we have 102 public entity clients that we place employee benefits coverage for you. Here in the Daytona Beach office, we handle about 62 of those. So right down the street here, we're working with 62 public entities. Our Daytona team, which is split between Jessica and one other producer, handles 17 public entity benefits placements right here in Volusia County. So what does that mean? Number one, it means we can provide you benchmarking. We can look at the other public entities in this area, understand what they're doing with their programs, and see if we can find a fit within Holly Hill to compare to those programs. The second thing that it does is it creates great relationships with our carrier partners. And I think it's no question that we have the best relationships of any broker in this county with our carrier partners, and that leads to better negotiating ability and better leverage for you, which is really what we're looking for, is to gain leverage with the carrier partners to deliver you not only the lowest price that we can, but give you a plan design that your teammates can live with, right? And that's what a benefits plan is. It's the way that we retain our employees and the way we retain our teammates. And in this distressed labor force that we're in right now, that I think we're all dealing with, not only at the city and county level, but at Brown & Brown, it's important that we're thinking about our employees when we're putting together these plans. So with that, I'm going to yield the floor to Jessica, and she'll walk you through our...
Thank you.
Good evening. I'm Jessica Scott. I currently serve as your account executive and have had the pleasure of working with the city for the last 10-plus years. So as Steve mentioned, I'm going to be as brief as possible, but I know there was a lot of information in our bid responses, and when you put proposals in there, it gets even more complicated and confusing, and so I want to walk you through what we submitted. We really tried to Keep your plan designs intact. So the process that we went through was to really focus on mirroring your plan designs and bring you the best rates that we could with the least amount of disruption to the employees. So I have proposals that range from an 8% increase down to a 10% decrease, as Steve mentioned, and I'll walk you through what those options are. So everybody has a booklet, and these are always so small to see. So if you go to the first page of your booklet, you can see it a little bit better. But this is your rate history in the top column, and what we've highlighted there is the 5-year rate history with Florida Healthcare. And that is a result of the city being a partner with Florida Healthcare, Brown & Brown being a partner, and us all working together to try to keep your rates as close to flat as possible, which we've achieved 4 out of the 5 years. And, part of that has been claims experience has been favorable historically. This year was a challenge with that. And so we had a little more of a challenging renewal, which I'll tell you more about. But I think the important thing is that Florida Healthcare's negotiation process and underwriting process is very unique and different than most insurance carriers. And so, typically when you have a 90-plus loss ratio, you would see certainly double-digit increases that would be very difficult to get down without making pretty drastic changes. And so I do want to show you what they propose to not make any changes and then some very subtle changes. So the next page, this just shows you your claims experience, which I've highlighted. The most recent that we were able to pull while we were going through the negotiation process is 103% loss ratio. So we kind of started in the 90s and it's ticked up as we went through this negotiation process. So if you flip a couple pages to page 6, thank you. I'll outline what has been proposed with the negotiated renewal. So they started in a 20% range, and it really came down to a business decision to try to partner with Brown & Brown and the city to give you the best rate possible to, retain their coverage should you want to do that. Without disruption to the employees. So what you're looking at is keeping the same plan designs that you have now, and there's some different options, though, that you can look at with, decreasing the rate a little bit further. So keeping the same plan designs now gives you an overall 8% increase, which is in the orange. And that includes keeping the gyms that are embedded, so your employees have free gym membership throughout their service area. They can go to any gyms that they want as often as they want, and that is free. They also have a clinic model with that, where basically employees, it was negotiated so they can go to the urgent care clinics where they can get primary care, diagnostics, and urgent care services at no cost to those employees, and I have some data around that as well. That will be embedded in all of these proposals with Florida Healthcare. But what you do have a decision on is if you want to keep the gyms in place. And just to touch on that briefly, I did put a gym report in there. And we have about a fourth of the employees going to the YMCA. Another fourth are going to Gold's in Daytona Beach. So we do have a good population going to YMCA, which I know, you could probably continue those services and work out a plan with the YMCA should you decide to get rid of the gym membership within the Florida healthcare plans. But I did want to show you, they are going to other gyms as well. And you have, good utilization within all of the gyms. And it saves you about 1% on the rates if you were to take the gym rider out of the plans. So that is what you're looking at in the green column on your spreadsheet. So that's down to about a 4.3%, or overall 7% increase if we combine both plans. And then you have the option to include the gyms, but also package the medical with the dental product that Blue Cross Blue Shield provides. That dental product did come in at a decrease. It's similar plan design to what you have currently with MetLife. And that's a voluntary product for the employees. It would save the employees about $5,000 and still provide what we did a network disruption to see if there would be disruption there, and it stacked up pretty much where the current network is. So we didn't see much disruption there at all. And
Meaning people can still use their dentist? Thank you.
And there are PPO plans too, so you can go in and out of network. You can really see any dentist that you want, but we looked at the in-network utilization to see if that matched, and it was a very good match.
Okay.
And so if you did include their dental product as a package, that saves 3% additional on the rate. So that's what's reflected in the highlighted gold column, down to a 5%. And then if you were to include the dental package but remove the gyms, that's the blue column where it goes down to a 4.5% increase. So that would be the lowest without changing any plan designs with Florida Healthcare. So those are the options on the table without changing plan designs.
So
I know-
Jessica, explain to me again why adding dental lowers our premium.
Well, because the dental product is also owned in the umbrella of Florida Healthcare and Blue Cross Blue Shield. So most insurance carriers, if you package ancillary lines of coverage, will offer a discount on the medical, because they look at that as additional premium that they're taking in on your group, and so it leverages some of the other lines of coverage to lower those rates. So that's the deal they put on the table. So you would get a 3% decrease to do that package.
Seems strange.
Okay, if you skip to page, real quick, page 9, I just want to point out the clinic utilization, because this is, again, unique to Florida Healthcare, and this shows you over a 3-year time period how many visits, which on average your employees have total visits of just over 300 annually. So you can see the utilization there. These have been very popular with the Florida healthcare plans, and this is the lowest cost option to seek services on the plan. So the more we can steer employees to use these services, the less cost to your plan. So it's a win-win across the board. It's free for the employees and a good deal for the Florida healthcare plans. So I did also propose an alternative plan. Again, I tried to concentrate as little changes as possible. So the alternate one plan on page 10 is basically keeping your copay plan the same. And so the same increase options would be reflected there. But this option is to change your HSA plan by picking up a higher deductible. Currently, it's at $1,500. This would go to $2,000, and picking up a higher max out-of-pocket at $5,800. But I wanted to keep the employees whole on this plan, meaning that currently the out-of-pocket expense that the employees have on their plan is $1,100, and that's taking into account that the city funds $1,900 that they could get towards their HSA. So they get that in their bank account. They're really out-of-pocket a total of $1,100. So I kept that the same on this plan by embedding an HRA, which is a health reimbursement account that you can pair along with this account. And the city would actually pay claim dollars as they're incurred up to that additional amount. So again, it keeps your employees whole where they would still only be out of pocket $1,100, even though the deductible and the max out-of-pocket goes up. And we have reporting to show how many employees typically hit their max out-of-pocket and deductibles. So I use that data to estimate the liability to the city to fund that HRA bank account. And so we came up with those numbers, and premium-wise, if you look at those two plans together, at the lowest cost, it's almost a 2% decrease in premium. At the highest, which still includes the gyms and does not package with the dental, is at a 1.4. But I also put in the liability to the city to fund that HRA account to keep the employees whole, and so that's what you're looking at on the bottom line. So basically, with including gyms and no dental, you'd be looking at a 4.8% increase, all the way down to a 1.5% increase if you included the gym, no gym, and includes the dental. So there could be some savings there, but if you flip to page 12, you get more savings with this plan if you were to end up dropping the copay plan and just going with a single plan, this HSA plan being the single plan. You would get the most premium savings here, so that would give you about a 10, almost 11% premium savings in the last option, which includes the dental package, no gyms. And when you factor in the HRA liability and the HRA administration, that ends up being about a 7% savings. So that's on the far side of what you could save. Again, trying to look at minimizing the changes to the employees. This gives them the same doctors, same HSA plan, same out-of-pocket cost. It's just flipping that into the HRA that the city takes on, but still, can save.
How many employees are using the HMO now? Do you know?
Currently, there are, and that is actually on
Somewhere in the packet.
page
There's
10, there's 21.
21? Thank you.
And you have 92 on the HSA.
Thank you.
So that's
that's-
employees' independence.
And that's continually flipping around, right? There's more and more each year going onto our HSA?
Yes,
Is that
we've
correct?
seen more migration.
Yeah.
Well, we eliminated the
Yeah,
32.
the high one.
26.
T26. When we eliminated the T26, most of them went on to the HSA, some of them went to the T32.
Okay.
The T32 did tick up a little when we eliminated the T26, but more and more people are going over to the HSA. So that number includes employees and dependents. It's not just employees.
Okay, makes sense. Thank you. Yeah.
And retirees.
Joe, didn't we back a couple of years ago talk about how we'd like to get onto just the HSA plan?
Yes.
Yeah.
That we talked about eliminating all others, and so that's
Yeah.
where we wanted to drive to anyway.
Yeah, we're driving to that, but you've got these small number of employees that want to stay on that T32 because they have higher medical claims for whatever reason. If it's not for them, then they're dependent. And they're not fully aware of the potential benefits that the HSA has. Now, we did do some calculations on some employees and determined that going to the HSA would in fact still be better for them off of the T32. But it's very hard to try to convince somebody who's been in that type of an insurance plan to switch to an HSA. It's scary for them.
I get it because I was on that plan several years ago and I switched.
You didn't have a choice.
Right now you have a choice, but if you go to the T32, you will have to pay even more toward your insurance for your deductibles and your dependents than what you're paying now.
Excuse me, Joe. Current employees, though hired after January 1 of
New hires.
2021, new hires, can only go under the T95 HSA plan. They don't have
Okay.
the option of going under the HMO.
That's right. That's, I think, what you're talking about.
Yeah, so we're
That's
moving
probably
new
it.
employees to the high
Okay,
deductible, but we
thank
still
you.
have the existing.
Sorry about that.
No, please ask away. I want to make sure everything's very clear. Any other questions on this alternative before I move on?
No, ma'am.
Okay. All right, and so I went over the single. So then we had a couple other options from other carriers, and we concentrated more on United Healthcare. We also got a proposal from Humana. But the reason we concentrated more on United Healthcare is I've had a lot of experience moving clients from Florida Healthcare to other carriers, being United, Humana, Aetna, so on and so forth. And, often we see a very good first-year deal. They discount the rates to get the business. And then second year, you're popped with a high renewal. So I, as much as I can, try to negotiate a second-year renewal rate cap. So we have done that with United Healthcare. It's at so your second year is capped at 12.9%. to give you some assurance that they're not going to give you a 30%, and that is negotiable, from the 12.9.
Excuse me, is United neighborhood, or are we
Yes,
further?
so United has two different networks, and so it all falls under the United Healthcare umbrella, but United Healthcare is the national network, where Neighborhood Health is their HMO Florida-only network.
Thank
So we try to identify on the spreadsheets what was what, because we did quote with both networks, and the United Healthcare network was much higher, as they would be being the national network. So I concentrated more on the Neighborhood Health network, which again is throughout Florida, but you don't have out-of-state coverage unless it's emergency. And there were some other options that we could offer in or out of these programs. There's actually lots of different options you can kind of toy around with, and they, move the needle a little bit on the rates. But I tried to narrow it down. So we had them match as close as possible to your current plan designs. And on page 14, we're looking at the Neighborhood Health Plan. So they've got the HSA option as well as the copay plan option. And this particular program does not include Walgreens in their pharmacy network, which frankly I see as a problem because your employees now can use Florida Healthcare, but they can also go to Walgreens. So, and there's not much rate differential to include Walgreens, but I wanted to show you the different options. And they have a program, a wellness program called Motion, which impacts the rates a little bit as well. So this first page really just strips away Motion and Walgreens, just to show you kind of what the stripped down rate is. And it still does have the rate cap. But, as I mentioned, there's not that much of a change in the rates on page 16 to include Walgreens in your pharmacy network and include, that still strips out the Motion program. So that's an optional wellness program that can be put back in for, it's about a percentage or so. And what that is a walking program, so it basically tracks steps, and employees can actually earn up to $1,100 a year towards their HSA bank account, which is nice. So it's something that obviously could be considered, and the rate differential isn't huge, but just wanted to try to give you the most cost-efficient options as close to what you have with Florida Healthcare. But again, United Healthcare had the rate cap. We did a disruption analysis. So with Florida Healthcare, it's a little tricky to do a disruption analysis because we can't get tax ID numbers, and that's what the other carriers need. So we did a manual process and basically looked up all the doctors with both the United Healthcare network and the NHP network. And that's the disruption that you're seeing on page 18, which, as I mentioned, I've moved a lot of groups away from Florida Healthcare to United Healthcare, and there's always going to be disruption because Florida Healthcare has many of their doctors as their own employees, so they can't contract with another network. So, you're typically going to see about a 50% disruption. So when that happens, we certainly have clients that for different reasons decide they need to move to another carrier, a national carrier. Then we help the employees find doctors. And, these times are challenging with doctors taking new patients and things like that. Because of COVID, everything's been backed up. But, we do offer those services to help expand the network, get your employees into doctors, should that be the best decision to make for your employees. But I did want you to see, where the differences are with the network. And so, just to kind of summarize on Humana, again, we did not press them for rate relief. We basically took their first quote, and typically we play them, against each other and try to, bring down the rates as much as possible. We didn't do that with Humana, mainly because they did not offer that second-year rate cap, and I was worried about what kind of renewal you would get. And so if you are going to make a big change like that for your employees, I wanted to give you some assurance that, again, you're not going to get a huge double-digit increase that second year and then have to make another change or do something drastic to your plan design.
That was MetLife or
Okay,
Humana?
Humana, that was Humana Medical.
Thank you.
Now, I'm just being conscious of time. I have ancillary in here as well, which I'm happy to go through, but let me know where we are on time and if
Well,
you
we
want
got to
to
get this done, so you have the floor, so
Okay.
continue.
Very good. Thank you. So page 19, we do have your current MetLife program, your dental program, which we negotiated to a 10% decrease. So basically, you can leave that program as is, not make any changes, and get a decrease there. And then we also had them propose a dual option. I'm doing this a lot with my clients, where you can basically have a lower cost program. So that's what we did. The first program, the benefits aren't as rich as your current program, but they're still, you know, good PPO benefits. You can go in and out of network, but that gets the rates to a lower price point if your employees are looking for, you know, something cheaper. And then we still have the high plan where they can buy up, be cheaper than the current MetLife program. So they did, you know, they could put a dual option in like that. There's lots of different ways we could go. Again, I tried to keep it succinct so I didn't confuse you too much.
Is option one the one that would pair with Florida Healthcare?
No, let me tell you about that one. That's going to actually be on the next page. And so we have MetLife first, so you can compare with the negotiated rates. Option one on that page is the Florida Combined Life.
Yes.
Oh, that's the one you're talking about. I'm sorry, yes. Yes, so that is the one. Yes, so they quoted the one plan design to match the plan that you have. They did put a 2-year rate guarantee. And again, they're coming down to about a 9% decrease from your current rates. So again, it will be a savings to the employees to look at that program, and they've locked you in for 2 years on those rates. And again, that's the program that would save you an additional 3% on your medical premiums, regardless which plan you go with. And then Guardian also put in a very competitive proposal at a 16% decrease, matching your plan design. And Guardian did have a superior network, too, I want to mention. When we did the network disruption, Guardian was a little bit better than the network that you have now with MetLife. And I had them also do a dual option on page 21, kind of like we did with MetLife. And so with that dual option, theirs was a little bit better of a dual option than MetLife, because their low plan, which is the first plan you're looking at, still has a $4,500 max, which is very nice on that plan. You currently have $5,000. And they have in and out of network benefits. But this plan was kind of geared towards employees that can stay in network, and then they'll get a cheaper rate to do it. So the out-of-network benefits aren't going to be as good. So if you're an employee that really, you know, can't stay in network, you want to see any dentist no matter what, then the buy-up plan would be the option. And again, it's still a 15% decrease from your current rates, includes that $5,000 max and some richer benefits than what you have today. So it was a nice pairing. And then I'm not going to spend a lot of time on the vision. IMED is locked in for 4 years, so you don't have any rate change there. Guardian did propose at a little bit of a decrease, but if you didn't go with their dental package, then these rates would go up, I think it was 30%. So, you know, you would only really want to look at that if you went with Guardian on the dental. Otherwise, I would not consider the vision. And also, the network with Davis versus IMED's network is inferior by quite a lot. IMED's network is much better than the network Guardian proposed. And then on page 23, we have the life insurance, which you are getting an increase with US Able. And so, and I tried to explain, you know, what was going on in the RFP with that. Hartford also proposed, but as you can see, they were much higher. So the recommendation would be to stay with the renewal with US Able.
Wow, 43%.
Yeah. Yeah, it's challenging every time we go out to market on the life because of the different classes and retirees. So it's, yeah, so we try to lock you in on rates as much as we can. So US Able did give an increase, but they locked in those rates for 2 years. And then the voluntary life is no change. So those rates would stay exactly the same, and they're locked in for 2 years for the employees.
Perfect. And before any questions, would you like to close?
I just want to say I appreciate the opportunity to go through this process. I know it's challenging to look at these proposals in this format and have little time to have discussion, but so I, do want to address as many questions as you have to make sure everything was clear. And, just know that we try to put our best foot forward with Florida Healthcare to allow you the opportunity to stay with them and not have disruption should you not want to with the employees. But we do think United Healthcare also put in a good proposal, and we certainly have the ability to help you with that change if that's the direction you'd like to go as well.
Okay, thank you very much, Jessica. Mr. Forte, did you have a question? No. Oh, I thought you raised your hand.
Do you have an answer?
I don't have any.
Is there any questions from the board? No? All right. Did you have anything to add? All right. Well, seeing none, thank you very much. Great presentation. All right. And so now what we'll do is we'll ask you to step out. We're going to have a discussion. Where is, oh, there's Scott.
There's Scott.
Thank you.
Clarify with him? Okay.
Did you brief Scott?
Yes, I did brief Scott on that dilemma, and he's going to just check the purchasing policy, but it does raise a level of concern that I don't understand why they couldn't put in the packet that we have the ability to offer Florida Healthcare if selected.
Yeah,
I just can't show you the proposal.
If they can't put all the information, like I said, just a note in there would have been helpful.
I don't know why. I can't give you an answer.
And then to not include the life insurance either.
Well, we know why they can't include their life insurance. That I understand. But I don't understand why they couldn't mention.
Then why?
Why what?
Why can't they include the life
He
insurance?
doesn't know.
Let
Didn't have
Diane.
the specifics.
Because actually, they had no claims history to go by. They
Okay.
only had census data, so it wasn't enough
Okay.
to receive a quote.
Okay, so I can't hold that against them.
I feel like
They
we
did
had,
mention Florida Healthcare in the package, Joe. I gotta
They
find it.
did?
Centria? I didn't see it in there.
I didn't see it in
Yeah,
there.
it was listed as one of the, and I don't remember why they didn't quote it, but they do have an explanation.
Well, I think they couldn't quote it because they couldn't get the data from Florida Healthcare because Florida Healthcare works through Brown and Brown. So where,
Oh, it just says current carrier.
Yeah,
Sorry.
current plans, yeah.
that's what raised the question.
What page is that on?
Beginning, was if they had it in
36.
carrier, why couldn't they offer it as,
36 of the original proposal?
Yeah,
it's the very beginning, right? We say page 6?
36.
No, when they had their presentation in the very beginning, they had a list of all their.
That's what he's talking about. It's the same thing. It's
Oh, I'm talking about this one, Joe. The
Yeah,
original one that came out.
Talking about
that's
the
what I'm
one
on.
they just
in the
gave us.
packet.
Yeah, so it mentions,
It
no,
just
no.
says-
It just says
that's
current
our-
carrier.
It just mentions that it's our current carrier.
Yeah. Okay. So do we still need a decision by tonight on this?
Well, like I said,
Because
if we're unsure and you want to not make the decision tonight and allow Scott some time to really come up with a legal opinion for you, you can not make the decision tonight and then schedule a special meeting to address just this. But I would suggest we do that before Commissioner Curry goes away.
Yes, I won't be here at all next month.
That's what I'm saying.
Could we possibly put it to the end of our commission meeting? And by then, he should have information for us, and
Well, let me just ask you, are you even interested in that? If you're not interested in going with
I
the
have
Centra,
mine
then-
completed, and nothing really changed my mind.
Other than
So-
that was new and surprising
Yours is what?
information.
mine's complete.
So I really, for me, I don't need anything further.
The committee is
The committee is the five of
The
you.
committee's us.
same as, right,
What?
okay.
But then when we get to
When
the,
you were saying the committee and the commission, it sounded like you were talking like two different groups.
They are-
No, we're
This is the-
supposed to be.
This is the committee, and
Four of you will be the commission.
Chief Bland is on the
Yeah.
committee, but the commission, only us four will be able to vote.
because John Penny has to recuse himself.
That's what I'm saying. So if the committee makes a decision and you're going to vote on this as the commission, then I would hope the commission upholds the committee's recommendation.
Here's what I suggest we do then, since I hear that we all have completed our forms.
Yeah.
If we turn in our forms and nothing has changed for any of you, if Brown and Brown comes out as the winner. If they have 3, or if they have the highest score when we tally them up, then we don't need to hear the rest from Essentia. But if Essentia comes out on top, then I think we need to use caution so that we don't open ourselves up to a lawsuit and
So if
just
you'd like,
allow Scott.
I could either collect the forms, or you can just verbally
Does everybody
state-
have them done?
Yeah.
Are you changing?
Oh, my goodness.
Does everybody have their name on them?
Fire chief. Come on.
So what you'll need to do is make sure your name is at the top.
What do we pay you to do? Work. Work.
Yes.
Hey, no, you're in the perfect spot
Oh,
to be
no,
a
no, no.
slacker.
Well, you got your form?
Yep,
Your name
you're
on
right.
it?
Except for Chief Bland.
Who gets these?
Everybody's making sure their name's on the top somewhere?
Oh, and
I signed it.
I signed it.
Okay.
Okay, that's fine.
Okay.
I just gotta make sure we know whose papers this is.
I'll collect them and
fine.
give them to Val, and then
Val?
I'll give him to Joe, he'll give him to Val.
I feel like it's election night.
Yeah. Oh, I'm sorry. You don't have to worry about that this year. I do. Well, coming up here.
True.
I have to worry about
You and Roy, right?
it. And Roy. Look at all those pickleballers. That's exciting.
Being taken over by pickleballers tonight.
I
know.
Hey, if I can't play, they can't play. I already turned ours in.
And just so you know, we will be doing the proclamation right at the beginning of the meeting, so you won't have to wait much longer. I apologize. You want to just go right now? If it's Brown and Brown, then this meeting's over. So,
Oh, then I.
yeah, oh, we'll have one right after this meeting, before the commission? Yeah. Or you can, yeah, yeah.
I felt like we had a presentation too. Two different presentations. One was a presentation, and one was just an outreach.
Yeah. It's true.
Real trying to.
Well, as long as it doesn't, it's not like a major issue that basically.
So the lower number is the better.
Bidding, but, you know, I don't think that's the biggest issue. I'm just trying to see if I can find which one it is.
Yes, so we have the results in, so Mrs. Clerk, can you please read the results?
Okay, there are 8 for Essentra and 7 for Brown and Brown, and the lower number is the better, so it would be Brown and Brown.
So you counted the
Did 7.
ranks, 1 and 2, 1 and
Yes,
2? So Brown and Brown was 7?
Yes,
Okay,
and Essentra is 8.
okay, all right. Commissioner Curry's walking back in. Brown and Brown was 7, and Essentia was 8.
8.
So for this committee, it's come out that Brown and Brown has the better proposal.
Okay.
So with
Thank you.
that, we don't need to extend.
No, so if that's your decision, then when you go to the commission meeting tonight, then you as the mayor or the chairman of this committee would say that the committee's recommendation to the commission was to support Brown and Brown's proposal.
Right, correct. All right, is there any further comment? All right, thank you very much, Chief Bland, for serving. I know
Thank
we threw a lot
you.
of numbers at you, 500 pages worth of
You're awesome.
material. Thank you.
Blame's on Penny.
All right, and with that, anything further?
Nope.
All right, we will now end this workshop, and we'll take just a very short bathroom break, and then we'll be right back to it for the commission meeting. This meeting is adjourned.